Don't be scared. I've done this before. Show me your teeth.
Hi there, I'm Dr. Scott Snellgrove from Cinnamon Park Vet. You've probably heard the often quoted statistic that some 85% of dogs and cats will have gum disease or periodontal disease by the time they're 3 years old. That's a slightly misleading statistic because it's only really true for dogs and cats that are fed on a standard diet, which is tin food or maybe dry kibble. So just because it's common does not mean it's normal, and it doesn't have to be that way. So really, when we look at carnivore teeth, they are designed for slicing and dicing and chewing through tough stuff like ligaments and cartilage and tendons. So unfortunately, even dry food or kibble, it tends to be more crumbly and crunchy and gets swallowed whole. If you look at what your dog and cat vomits up after it's eaten its dinner, most of it isn't chewed, it's probably swallowed, and the few little bits that are crunched up quickly tend to be still stuck to the teeth. So what I'm saying is you won't find many dentists recommending biscuits for children, as a tooth cleaner at least. So if you want to clean teeth, you have to go the extra mile. So what would an ideal tooth clean look like? Well, first of all, it should be tough and chewy, not crumbly and crunchy. It should be removing food from the teeth and polishing the teeth, not leaving food behind. It should last long enough that the dog is going to spend 20 or 30 minutes in the back garden chewing, not woofing it down in 5 seconds flat. So it's not just the activity on the teeth and how effective it is, but how long the dog actually spends using the product. And really you want something that's going to be there long enough to stimulate a little bit of saliva flow. Saliva has a natural antiseptic action, it washes the teeth clean, it has enzymes, so to really get the digestive juices flowing you really need a little bit of chewing. And don't forget, food is a really big part of a dog and cat's life. They're hunting animals in the wild, they would spend a large part of their day finding food, eating it. It's very mentally stimulating and satisfying. By the same token, if you have a dog that's sitting in front of a bowl of dry food, it's gone in 5 seconds flat. It doesn't really, it leaves a big hole in the rest of the day.
Don't be scared. I've done this before. Show me your teeth. Show me your teeth.
Okay, so let's review a couple of the more commonly used dental items that you may see out and around. Starting first of all, this is a dental stick, as you'll find in most supermarkets. I've done a little experiment where we just soaked that in a bit of warm water beforehand, just to simulate the conditions in the mouth where you've got a saliva flow, the dog's going to be chewing on it, and when we look at it, look at the sludge coming off that. Again, if we rub it along the teeth line, you can see all this stuff that comes off. It's really leaving food behind for the bacteria when the whole point is to try and remove that. Next item called a greenie, a slight improvement. It is slightly less sludgy, it's got more of a waxy, rubbery, flaky texture, and it does have some benefit of having a thing called tripolyphosphate, which is a tar inhibitor, inhibits some of the mineral formation. We'll give that maybe 1.5 stars. The cat equivalent, as far as I can tell, doesn't contain tripolyphosphate, and for all intents and purposes is just another green cat kibble biscuit. Maybe part of the problem rather than part of the solution. I'll give that 1 star. The next one we'll look at is the humble pig's ear or rawhide. Now again, when we dunk that into warm water, it fluffs up. It goes a bit like a chamois cloth, so again, very good at wiping food off the teeth, and there's nothing really deposited behind. So again, it has a slight polishing, buffing, and I think they're a good, cheap and cheerful option. The humble pig's ear or rawhide, and with the added bonus, no real calories, it's like eating leather. So we'll give that one maybe a 3 star. Next option, toothbrushing with or without a dental gel. I tend to use this mostly where we have established gum disease, where teeth are already lost, because sometimes when the top tooth is lost, the bottom tooth doesn't have anything to chew against and it doesn't self-clean. It may be worth targeting some of those teeth with the brush. Toothbrushing is very good at removing food and soft tartar from the teeth, it's not really going to remove any mineralised hard plaque. So it needs to be done very regularly all the time, and to be fair, most people struggle with it and most dogs and cats don't necessarily enjoy it, but it has its place. The other thing I would say is it's a very passive activity. You're doing all the work, the dog is not chewing and not getting saliva flowing and not really exercising the bones and the ligaments that keep the teeth. So it's a passive activity, it's not an alternative to chewing, it's a supplementary action. Next one on the agenda, Kong. These are like a rubber item. The idea is we often put like a toothpaste inside and around the crevices, and that works quite well as a polishing, massaging item. Again, no calories, it's not leaving food behind on the surfaces, it has a bit of a polishing action and it works a bit like a squeegee, so we'll give that one maybe a 3.5 or a 4 if you combine it with some dental gel. Another item here, it's a relatively new one. It's a seaweed extract which is fed in the diet, and it contains an additive that inhibits in the saliva the formation of the glue that the bacteria use to stick to the teeth. It's a very good option for dogs that have existing receding gums, dogs that struggle to eat harder materials, or dogs that just basically already have problems. And very good for cats as well, because often they are far less amenable to teeth cleaning or chewing items. They don't tend to chew for fun, unlike dogs. Wouldn't it be great if we had something that was low calorie, it would keep the dog entertained for maybe half an hour or so, it was environmentally friendly, it was easy to get hold of, maybe even something that would remove the light mineralised like lime scale, hard enough to crack that stuff off, but still soft enough to massage and polish the teeth surfaces. Well, at the risk of reinventing the wheel,
Don't be scared. I've done this before. Show me your teeth.
the tried and tested formula for dogs' teeth is usually chewing meat off the bone. It's what they do. They're carnivores, and these are carnivore teeth. You'll sometimes hear people say that bones are dangerous, either because they will choke. Well, a greedy dog could choke on anything, be it one of these. You can bite the end off, you can choke on chewing on the end of those. The answer is not to put the food through the blender and stop the dog chewing at all, because all that will happen there is the dog will be having an anaesthetic every 12 months, which is not without its risks, or the dog will be getting gum disease and pumping bacteria into its gums and kidneys, not without its risk. But on balance, dogs have been chewing bones for a lot longer than there have been vets, and provided it's done sensibly, I think the benefits far outweigh the risks. We see plenty of 10 and 12-year-old dogs in the practice that have got a perfectly clean set of teeth. They're a little bit worn, but they look more or less like this. On the other hand, there's plenty of 3 and 4-year-old dogs in the practice that eat soft stuff where their teeth look a lot like this. So again, it doesn't have to be that way. You may even hear some dentists saying, oh, there's a risk that they may break a tooth. Frankly, I would sooner take out a chipped or broken tooth from an otherwise clean mouth than I would extract a whole mouthful of teeth that are all loose and pussy and infected and doing the dog's health no good at all. So on balance, I think everything in life has a little bit of risk to it. You can go jogging to get fit and have a heart attack. That doesn't mean to say you shouldn't do exercise, so I think we need to keep it in some sort of perspective. Personally, my dog gets a bone twice a week at least. He's never had a toothbrush in his mouth, his teeth are clean, and I have to say that's the typical experience rather than the typical experience of the dogs that don't chew, that have pretty disgusting teeth by the time they're 3 or 4. And just a few other little tips. If you have a dog that has a lot of hair around the mouth, like a Maltese or a Schnauzer or a Poodle, it definitely helps to shave a lot of that hair away from the mouth. What happens is it wanders into the mouth, and you'll be able to see if there are wet hairs around the mouth. They often trail around the teeth. They pick up a lot of bacteria, they irritate the gums, they might break off, and often you'll find hairs embedded into there when we take rotten teeth out. So keeping all that hair out the way will improve your mouth hygiene and it will certainly slow down gum disease and save you a few dental bills. Secondly, in terms of choosing an appropriate meaty bone for the size of your animal, probably for something like a kitten or a puppy, you might want to start with just the very tip of a chicken wing tip. Again, fresh and not cooked, just to get them in the habit of chewing. Remember that kittens' taste habits are set early. Trying to introduce meaty bones to a cat of 2 or 3, it's not going to work. Their habits are set early, even whether it's dry food or wet food, so you want to introduce them as kittens. So middle-sized dog, you might be looking at a chicken neck. A larger dog, maybe a lamb shank, right through, just scaling it up according to size, but you definitely want the meat left on the bone, not cooked. So some of those baked, boiled, scraped, naked bones, it's like chewing on a brick. There's no cushioning, no work, and there's nothing for the dog to sort of massage the teeth on, so they're the ones that tend to chip the teeth. So again, fresh meaty bone, leave the sinew on it. So I hope all that helps. I'm Scott Snellgrove from Cinnamon Park Vet. Hopefully save you a few dental bills. Thanks for listening.